welcome everyone to another Women's Health Tech Wednesdays. My name is Nina Joshi, and I am very excited to bring out our guest today, Fran, who is the president of REACH. As you know, we love questions here on Women's Health Tech Wednesdays. So if you have any for Fran throughout our conversation, please feel free to use the Q&A feature at the bottom of your screen so we can get those answered. So with that, I would like to formally bring out our guest, Fran. Hi, Fran. Thanks for being here today.
Thank you so much for having me, Nina.
Of course. And, I am especially excited to talk to you today about maternal health. I know that this is an area that I think we are both passionate about, but really a huge opportunity within healthcare in general. And in my role as a researcher at Kaiser, what we've really been seeing is that for a lot of women, pregnancy, maternity, this is kind of the first opportunity that they really have to interact with their healthcare system in a very big way. And what we've been seeing is that for a lot of new moms, this is a very, very tricky system to navigate. It's just so hard to navigate a large healthcare system. They are very overwhelmed with just the amount of information that's being thrown at them. And they're really just looking for someone to empower them, to support them, to make them feel prepared kind of within their care team. So really interested to kind of get your perspective on that and if that's something that you've seen as well.
We absolutely have seen that, Nina. I mean, when I think about it in the context of the research that we've conducted, both that looked at clinical empathy and what women and their families are looking for in the context of what are sort of identified as these really monumentous, right, moments in life. They're really looking to be able to interact with the healthcare system in a way that's in some regards a little bit more intimate than the system itself is really prepared to take on. I just imagine even the ultrasounds as an example, right? When you're getting those periodic milestones and they're doing ultrasounds and you're receiving the images, for the mothers, and the families, it's a really big deal. But for the technician or for the clinician, they see it day in and day out. So how do we make those moments feel special for families is really important.
Yeah, that makes a lot of sense. And I really like that idea, just the concept of having, more empathy and really providing opportunities for women to, have those experiences. And it was kind of something that we've seen as well a little bit kind of within my role in research where, clinical care and having really great clinical outcomes, that's almost like an expectation. That's a given. What they're looking for now is an experience, is a bonding experience with their provider. So it's really interesting that you've kind of also seen that as well within your research. And kind of diving into your research, because now I'm very curious from your research, from your experiences, what are some of the issues or the areas of opportunity that you've seen within maternal health?
Honestly, there are just so many, Nina. I guess, first and foremost, the thing that stands out as you were asking that question is really around the need to feel like you're being heard. Women don't feel as though they're being listened to. So a separate study that we conducted over 2020 and 2021 looked at women's perspectives and experience around the perinatal period and their encounters with the healthcare system. So it's sort of their views on perinatal care. And of the questions that we asked, we had over 1,000 respondents. And what came out of that was really kind of alarming. The first of which is that they felt over 25% feeling that their providers really didn't have enough information about them. They felt as though there was much more than what was happening within their encounters and the questions that were being, I guess, asked or information that was being shared that was sort of, that it was incomplete. Another thing that was really big from our data was that there was what I would consider to be a significant number. I mean, we had over 15% who felt as though if they had the opportunity to change providers that they would have. Wow. And that there was even a percentage of women, yes, I know, and it gets worse. There was a percentage of women who felt that their clinicians didn't care about them and didn't care about their babies. And that was To me, I felt like that was really shocking. I mean, on the one end, we can all nod our heads and say, yes, well, that's no surprise. And we say that, but it kind of really is when you start to really look at the numbers, right?
Right.
So if we're talking, 15 to 20% of 1,000 women,
Mhm.
right? That's
Mhm.
that's a large number.
Absolutely.
Um, so for us, we feel like there's a lot that could be done
Mhm.
to change that. Some of
Mhm.
that I think is really doable in terms of being able to fix, but there's just it's surprising what the data shows.
Mhm. I think what you're kind of explaining, it is really sad that it kind of comes as no surprise. There is a really big culture around like dismissing women's concerns within healthcare. But something that I've kind of heard, and curious if you've seen this too in your research, of this idea of, we're used to women, like doctors talking to you, but there's now this like a really big push, or just this demand for involve me in the conversation. Like, I also want to be empowered to make these decisions together, instead of you just talking to me and just telling me all of this information. Like, how can I also be involved in the conversation and be an active participant in these conversations around my health? I'm curious if you've seen anything like that too.
We have seen that, but I would say that more so the problem goes back to that listening element, and
Mhm.
that is that oftentimes women will share things that they're experiencing during their pregnancy, and they are dismissed. And now, coupling the data that we've done with some amazing folks like Dr. Heidi uh, Altman, she's actually a social anthropologist out of
Mhm.
Georgia. Her data, I think she's with Georgia Southern University. She's amazing, and she was actually on the Reach on our Reach Radio podcast. We did an interview with her, and she also came to the Match Coalition and shared some of the insights that came out of her data, and the
Mhm.
type of verbatim. Again, as a social anthropologist, they tend to do things verbatim. Her
Mhm.
verbatim reciting of the experiences that women have had just
Mhm.
were appalling. Um,
Wow.
some of them, for example, being women having to travel over an hour in labor to get care. These are women in rural
Oh my
communities.
gosh.
You know, obesity is a problem in America. It is, it itself is an epidemic. Seeing the increasing numbers of individuals who are struggling with weight management is a reality. And
Mhm.
so when you combine that with pregnancy, it can create a lot of complications. But
Mhm.
clinicians need to be prepared and feel comfortable in having conversations with women about their weight.
Right.
One of the examples that she cited was a woman who was turned away because she was fat, and the clinician didn't want to provide care to her.
Oh
And
my
that was the
gosh.
word that was used to
Mhm.
describe her condition. I just, these, very sad and appalling stories that occur.
Yeah.
Now, we took our information, combined again with the work of Heidi and others, and
Mhm.
then coupled that with our own research where we had directly been interviewing with practitioners, with care
Oh.
providers.
Mhm.
And they themselves even admit to, struggling to listen, right? Being bombarded. Now, some people like to point to EHR systems and say that that's the problem. But the reality is when you pull that out of the picture, it's a little bit, there are many more dynamics that lead
Yeah.
up to that. And some of it, quite frankly, is them being ill prepared to be
Mhm.
able to have difficult conversations with
Mm.
families and with expectant women.
That's really interesting. So it's kind of, they just did not feel like they, had the proper training to be able to have these types of conversations.
That's exactly right. And
Interesting.
and equally, there's sort of being this misunderstanding about what clinical empathy is.
Uh-huh.
And when you're supposed to take on a space of neutrality,
Mhm.
right? When it comes to managing a case, um, you know, not being sure about, well, how does empathy show up? How do I express empathy or appear empathetic
Right.
without giving too much of myself or becoming too involved with my cases?
That is really interesting. And how would you, I mean, just kind of curious for your definition of what it means to have like clinical empathy, or what that kind of looks like to you.
Well, there's sort of, from my perspective, there's sort of two ends, right? There is the sort of responsive element. The
Mm,
responsive element is often what we tend to do, right? It's like we want to say, oh, um, oh, that's so horrible. We want to sort of bring forth that emotive piece, which
right.
isn't necessarily what's needed.
Mhm.
Many times it's that women, particularly when they're pregnant, are looking for choices and having the ability to have a sense of control in a situation for which, let's face it, a lot of what's about being pregnant is out of your control.
Yeah. Yeah.
So that's one element. Then the second element is a sort of expressive empathy.
Mm,
And having that, having it to come up and showcase in ways that sort of mirror back to the individual that you're counseling or consulting in
right.
a manner that is that they can be receptive of, right?
Mhm.
That matches them. Don't be overly alarmed if they're not overly alarmed, right?
Right. Right.
Or don't take them down a path that maybe it's not a path where they want to go. It's really
Mhm.
about sort of meeting an individual where they are in that moment and checking in with them, asking more open-ended versus closed-ended questions so that you can get a better frame of where the individual is in that time and moment, and
Right.
and be able to more appropriately make recommendations on what to do next
Mhm.
based on that individual's personal circumstances.
Absolutely. I loved the two things that you mentioned that I just love is the idea of meeting people where they're at,
Mhm.
and then presenting them with options and kind of really allowing them to feel like they are empowered to pick what's best for them.
Mhm.
And thank you for that definition. I mean, I think you really spoke to a lot of the nuances that I think can be missed when it comes to just this idea of empathy within, a provider
Mhm.
perspective.
Thank you.
Um, Going back to your research, I know that you did your own research within Reach. You kind of used and worked with others in terms of partners. What were there any next steps that you kind of took to kind of combat or to help maybe even just bring light to what the astounding statistics and stories that you saw within this research?
Yeah, so a couple of things. So for Reach, we are all about research, education, thought leadership, and innovation.
Hmm.
So we really try to, as we sort of look at an area or a problem, try to ask some of the hard questions. That's
Yeah.
why we spend a lot of time then educating people on those findings, right? So
Hmm.
when we say that we, inquired with women and these are the things that came back with us with, it's because we took the time to be very deliberate and specific in the question. I mean, we literally asked, do you feel that your provider cares about you? Right.
Yeah.
So very being more direct in our questioning allowed us to be able to go into a space with women that, quite frankly, most of the times organizations and healthcare providers tend to want to dance around. They want to ask indirect questions and then draw assumptions
Yeah.
as opposed to being more direct. So
Hmm.
for us, our willingness to go there and that's what I mean when I say about meeting people where they are, is really being able to be direct and and fully show up in the conversation. We were able
Hmm.
to then turn that around into our innovations. And
Mm,
so for us, that's come out in quite a few different ways. One of them is our work within the National Save Moms campaign, which is all around elevating the voice of expectant mothers. Also, the work that we do in drawing awareness to clinicians, helping them to gain more insights into what it is that their patient populations are looking for. And then
mhm,
thirdly, and perhaps more boldly, has been our program, which is known as Happy Mama. Happy Mama is our biopsychosocial wellness platform.
mhm,
It's both a digital platform, but it's more than that. It's actually a program and it's a community. So it is a maternal health community outreach program where we go
mhm,
directly into communities and we work alongside with providers of care and also with community-based organizations to deliver programs that women care about on topics that they care about that are related to their pregnancies. And so all of that sort of really complementing and drawing from the insights that we found from our research.
Wow. That's so much work that you've done to kind of carry that forward. That's incredible.
It's exhausting.
Yes. Well, you're definitely fighting the good fight. I mean, I think it's always so great to see, that there's that things have moved from, from like theoretical to actually action. So I think that is amazing to see. Also kind of wanted to pick your brain about kind of shifting gears to talk a little bit more about some of the technology that we've seen within the maternal health space. And the reason why I'm just so curious on your take is because I think whenever we talk about technology and these types of new solutions, I think we always talk about it from the consumer lens and how, what this means for patients, but curious to see if you have any insight on, the provider perspective when it comes to all of these new apps and technology and all of these other, things that are being added to this maternal care journey within the healthcare space.
Yeah, I don't want to make it overly simplistic, but as you were asking the question, the thoughts that came to mind were really centered around, little bit of lost and sort of daunting, right? So what we have seen in a lot of the research that we've done, and these being programs, particularly during the pandemic, we started, gosh, I don't know, 3-4 years before the pandemic with our research, but during the pandemic, we really drove even deeper because we wanted to understand in the midst of the pandemic, how were maternal health care providers utilizing the technology? And the truth of it is that the majority were not. And a lot of, they were not. First, it's sort of, I'm sure you've heard this probably with others that you have spoken with, while we made great strides and effort, and there really was there is a lot that we were able to accomplish with the use of telehealth during the pandemic. It was really not so much centered around maternal health where it was being utilized, and the percentage of organizations that were adopting it were not very significant, right? I mean, arguably for technology that's been around since the 1980s, 70s, and 80s, to say that we had 30% adoption, while in an absolute number, that's a large number, it's still a relatively insignificant compared to where we could be. Although, if there's anything to be grateful for, I think we should be grateful that the technology was there and that people were utilizing it. But I think that we could have utilized it to a much greater extent than we did. And so when we look at not only telehealth, but also remote patient monitoring and many of the other digital technologies that are out there, what we're finding when we are working with providers is that much of what we're getting back is that they're not trained on the technology, right? So there is a lack of confidence in the technology. And then equally, still today, the reimbursement models, the system is so convoluted and confusing that it makes it difficult for providers as well. Everything, things are so, they're as clear as mud, right? It's difficult to kind of maneuver and figure out the payment structures as well. And so obviously that all of those things combined really impact the speed at which we see adoption within the maternal health space, like in many other spaces as well, but most certainly within the space of maternal health. This is why we formed what is known as the MATCH Coalition, which is the Maternal Application of Technology for Community Health Coalition.
Oh, wow.
Yeah. And the MATCH Coalition is a public and private sector group that comes together. We meet monthly. In fact, we just met this week. Yesterday, we had Congresswoman Robin Kelly from the state of Illinois to come and present as part of our spring virtual Hill briefing. And, the purpose of the coalition is really to focus in on emphasizing and drawing awareness to the clinically appropriate application of digital technologies for maternal health and well-being. There's so many ways in which it can be deployed and great value can come from it. But while there is more investment going into the maternal health space, we're not seeing much of that really directly and clearly going towards the utilization of digital tools. Do you mind if I give you an example of that just super
Yeah, please
quickly?
do.
Okay. So, one example of this is maternal mental health, where we know that there's a large percentage of women who suffer from mental health during pregnancy. It's unfortunately a common condition that women suffer from postpartum depression, varying degrees of it. We should acknowledge that some more severe than others. Yet, although we know as well that the use of remote solutions is a very clear path for that, there's really not been a lot of emphasis on leveraging those tools. So when, for example, we say, oh, we're going to extend postpartum support for women, right, for an additional 12 months, what does that mean? If you ask Medicaid, and I have, of multiple states, and I have at the highest levels, there's no clear-cut answer as to what the coverage is for specifically, right? Like what are we going to get more of the same out of that? So there's really a lot of unclarity around where funding is going, how digital technology is playing a role within that, when there's so many areas and opportunities to apply it, even when it comes to things such as preeclampsia, as an example. There's just, there are no direct answers, even though we're sort of seeing a lot of activity. And I'm grateful for all of what we have accomplished thus far with the Momnibus Act and many other initiatives that are underway. But I would say it's still insufficient relative to the amount of need that's out there.
Absolutely. Wow. I mean, I think the fact that you are just really, striving to make these large scale changes, I think is so incredible to see. I mean, I'm hearing about all these amazing programs, and I think the work that your team is doing is absolutely incredible. So just wanted to call that out.
Thank you.
Yeah, of course. And so before we get any further, I know we have 5 minutes, but just quickly wanted to ask you a question that we got from the audience. So this was around the research that you had conducted around just women's sentiments towards the provider during pregnancy. We had a question from the audience asking where she could get that data. Is that something that's on your website or any other resources for those that are interested in learning more from that?
We didn't issue out a full report. What we do and have done is we've incorporated directly into the articles and the white papers that we've produced. So we did most recently, as an example, publish a white paper on reversing maternal morbidity and mortality. That actually came out on Mother's Day. So you'll see a lot of the data appear within that. There are other papers as well that appear on the reachtl.org website under resources, and just select maternal health. And those equally reference those statistics and many others that came out of our research.
Incredible. And this may actually answer the next question that we have, which is how to learn more about the Match Coalition.
Yes, so the Match Coalition, you can visit matchcoalition.us to get more information. And again, it meets on a monthly basis. We're really excited this year because we have doubled down on the highest states with the states with the highest rates of maternal mortality. So this coming month of June, the focus will be on New Jersey. Which, if you're not, for those who aren't familiar, unfortunately, New Jersey is on that list of states with higher rates. And we look to be able, it's not so much as just an.
Oh no. I think Fran froze. See if she's able to come back on. Right in the middle of a really important conversation about Match. Let's see if she's able to hop on in like the next couple of seconds. And if not, then I can just have her send all of that information around Match out to the group if anyone is interested in learning more about that. But let's see if she is able to come back on board. You all can hear me, right? Is it on my end? Hey, Fran.
Hey there.
Awesome.
You know, I have said all week, and I don't know if anyone else is into this, but Mercury is in retrograde, and I have been feeling it for over a week. Like, I kid you not, like my computer just went completely black.
Oh my
So
God, I
what's
love
a
it.
good interview need if it can't be fun, right?
I agree with you. I feel like this is just what makes it, in my opinion.
I know. So what's the lesson learned? The lesson learned on this is in digital health, digital tech and digital health, things are going to happen, right? And sometimes the systems are not going to be as stable or reliable as we'd like them to be. So you have to have your contingency. Like, you've got to have your backup. When we look at programs for women, it's so important that, you know, we be, as we are generally, so resourceful, right? Mm-hmm. And so thank goodness I have my mobile device by my side.
Oh my gosh, I love it. Well, that is amazing. And I think, you know, speaking to that within, you know, this last minute that we have, I mean, I think, you know, what we're seeing from just the audience, there's a lot of interest around the work that you're doing. Would love if, you know, you just take this time to just have the spotlight shown on you. Are there any events, any other initiatives that you want this group to be aware of?
Yes. So the hugest event for us is Happy Mama Live and the Happy Mama Expo. So what we do is, our platform is a biopsychosocial wellness, physical, mental, spiritual, emotional, and social economic support for women. And as I mentioned, while it is app-based, digital-based, it's a hybrid model where we work in communities. So we take it out and as Happy Mama Live directly into communities. Like, we are going across the state of Tennessee right now, where we're doing these small programs to share with women. The other thing is our Happy Mama Expo. It is the largest online fair that happens at the end of the year. October 27th, I believe, is the date. So visit happymama.global. For those who like to exhibit, we're even looking for dynamic speakers. We'd love to hear from all of you. There's a space for everyone within the Happy Mama community.
I love that. That sounds incredible. And all of that information, thank you, Lisa. She just put the website in the chat, so please be sure to check that out. And I just realized that we are at time. We have still so many amazing conversations.
I know, it went so quickly.
So we'll definitely have to do a follow-up, a part 2 at some point. But Fran, just really wanted to thank you for taking the time to chat with us today. What an enlightening conversation. So really just wanted to thank you for just sharing, you know, the work that you're doing and just fighting that fight. I think it's incredible.
Thank you. Thank you so much, Nina. And thank you to everyone at HITLAB as well.
Thank you, Fran. Awesome. And so please be sure to tune in next week. We'll be talking to Concert AI. Also wanted to let you know that we have our symposium next week as well, kind of speaking to women's health and mental health. So please be sure to check that information out. Thank you to our sponsors, Goodwin and Witham. One last huge thank you to Fran, and thank you all for joining. We will see you next Wednesday. Bye, everyone.